Cloud. Yay! We are recording to the cloud, and I am Andrea Gigline. As always, that's one of the things in life that doesn't seem to change for me, and I'm holding on to all of those that I can these days. And this is another episode of Still Rising. And what we are going to do today with my guest, Dr. Eboni January, is have a conversation that needs to be passed around to as many friends as you can possibly send it to, because it is about women's health and women's health specifically in underserved communities. And at this moment in time, I think everybody kind of feels underserved in the medical community. So, Dr. Eboni Johnson, Dr. EJ, as you are known to your audience, welcome and thank you for joining me today.
Thank you. Thank you. I do appreciate it. You said something key. You said you feel like everyone's being underserved, and that's absolutely the case. Even myself, I'm a woman first before I'm a doctor. And I'm also licensed in now 16 states. So I've seen a lot, not just Black and brown women, but I've seen all women. And I'll say that it is a very universal statement is that everyone feels unheard, unseen, unfortunately. And even myself, when I go to the doctor, I also feel the same way.
Yeah. You know, I want everyone to know you are by trade a
Hmm.
GYNOB.
Yeah.
And you fit so beautifully for the theme of Still Rising. I mean, I sit before you with a PhD and having owned a bunch of businesses, yada yada.
Mhm.
But I started as a secretary going to secretarial school.
Wow.
And where we start, the one thing we know is never going to be where we end up. So I want to inject at this moment in time, before you give us a little bit of your origin story,
Mhm.
because the work you do in helping educate, how's that for a book?
Oh, you have the book.
I have the book. This
That's
is a fabulous workbook, The
Thank you.
Empowered Motherhood. And that's why this is such a universal topic, because you will speak specifically to the Black and Brown communities. But I'm going to tell you something. You talk to the 20 and 30 somethings who are having babies today, and
Mhm.
it is not a warm and fuzzy experience. And your book touched my heart. And I know that it's a workbook that goes along with workshops that you do, in addition to a lot of online stuff that you do. But what struck me about it, and this was one of those, moments, because I've been doing two pieces of work. One is in how women's health through menopause has really been underserved to the max, no matter your color. If you have ovaries, you've been underserved
Yeah.
because the research is so fragmented and really wasn't on target. We're getting there very fast right now.
Mhm.
But in that research, I realized here I sit a heartbeat away from 70, and I remembered the jokes years ago about taking sex ed classes where your girls were given mirrors or given an assignment to go home and look at their private parts.
Yeah.
I, I had no idea what those private parts looked like,
Yeah.
and nor did
Yeah.
I think I had much interest in looking.
Yeah. Yeah.
Okay. And so today, to know that we have communities of women who are reading more, who are doing more.
Hmm.
That's why I wanted to get your book out there. And I wanted to um, talk to you about the thing that is the one myth
Yeah.
about pregnancy or postpartum that you wish every woman understood the truth about.
Yeah. So one of the myths, and I think that is no longer becoming a myth, is that the postpartum period, like your feelings are normal, right? we live in a day and age where one of the top causes of maternal morbidity and mortality is mental health disease. So
Right,
some people, including significant others, think that the hormones that are associated with pregnancy and the postpartum are all normal. They're
right,
not all normal. And we need
right.
to understand what's normal and what's not normal. And we need significant others. We need doulas. We need support persons, friends to be able to identify these significant changes in women because women are dying secondary to postpartum mental health issues. So not everything is normal hormones, right?
Right.
Some things are abnormal. So anyone watching, anyone listening, if you are a support person of someone who's recently postpartum, whether you are a significant other, you're in a same-sex marriage, if you are a friend, an aunt, an uncle to this person, pay attention to what they
Mhm.
say, but also pay attention to what they don't say. And I think that that's very important. Don't just write everything off as hormones. She's not sleeping just because of the baby. No, some lack of sleep is postpartum depression. And so I
Correct.
think that that's one of the biggest myths I really want to address.
Beautiful. Now, again, because I want to make sure people who need information get it as quickly, would you spell out your website? Say your website, spell it out so that the
Sure.
closed caption puts it out there?
Absolutely. It's drej.com. That's doctorej.com.
Perfect. Now, now let's start where normal interviews normally start. How about you tell us who you are and how you became passionate about this topic?
Sure. So I'm Dr. Eboni January. I'm a board certified OBGYN author. As you know it, this is my third book, my second physical book, Empower Motherhood. And I wrote it in response to my patients, a lot of women who were lacking knowledge on a lot of topics. I'm licensed in now 16 states. I did that because I wanted to be able to educate from a place of knowledge myself. It was kind of my own market research.
Sure.
Also do a lot of training for physicians on implicit bias, cultural competency, cultural and linguistically appropriate services, the social determinants of health, which we'll get into. So I train
Yep.
on the physician, medical student side of things, but also from the workshop side of things, I educate a lot of women. I also have wellness products that I built in response to my patients as well. I do a lot.
Yeah.
And
Yeah.
so one of the reasons that I got into wellness in general was because of my father. My father was an all-American athlete. He was really, really into to sports and health and juicing. And he actually came from a family of 14, and he was one of few that was college educated in his amongst his siblings.
Hmm.
Also, he was one of few that was into healthcare. I watched him desperately try to bring his family along, right? But unfortunately, especially in the community that I grew up in, many people are reactive as it pertains to their health as opposed to proactive, right? And
Right.
so even though I went to medical school, I had a strong foundation in wellness, and that was secondary to waking up listening to the juicer every morning. And that was my dad juicing. He knew what vegetables healed certain ailments. He knew what fruit combinations healed certain ailments or prevented certain ailments. And so the doctor side of things, what really garnered my interest in becoming an OBGYN specifically was my grandmother. I watched this person who had given life to so many individuals. I watched her body change and her body deteriorate. And my grandmother died in her 60s. So she was
Wow.
pretty young when she passed away. But I also watched her daughter struggle with the same things that my dad was trying to prevent, even though they were siblings. And so the combination of me being a physician but me also having a strong wellness background because of how I grew up, even though I grew up in a very underserved area, my dad grew vegetables in our backyard. So
That's fabulous.
the combination of the two is how I really start utilizing those things in order to help my patients.
I love this. For 10 plus years, since 2014, our family's been involved because my daughter was one of their original volunteers and then became their executive director of an organization called feast.org and based out of LA initially. And what they do is help primarily it started as underserved, but like everything else, you start because there is a concentration where it's so blatant. You know, if you live in South Central LA and the only store you have is selling, you know, packaged foods of all forms, there isn't
Yeah.
a fresh anything. It's easier to go in there and institute a program because
Yeah.
statistically you have a base of people to help.
Sure.
And I have collected over the years, I've gone to the graduations of their every 12-week programs from time to time, and you hear people tell the origin story of
Yeah.
how they did not have what
Hmm.
you had. You know,
Yeah.
you mentioned something that really spoke to my heart. I come from an Italian American family where all the grandparents were born outside the United in Italy, and the grandmothers gave birth to at least 10 plus babies each.
Oh, wow.
So died very young.
Wow.
One died of pneumonia very young. My mom's mom died around 60 of stomach cancer. And she's the only person who we've ever had. There's only been one of her children who ever had cancer that is not known as a social, like if you smoke 3 packs of cigarettes a day and you get lung cancer, it's not bad luck. It's,
Hmm.
you know, there's a cause and effect there. There's a correlation, if not a cause and effect.
Sure.
And I keep thinking about how fortunate, and I have said this many times, because I remembered, as you probably did, or you know, you were a little young to actually see the originals of it, but Oprah Winfrey was very public with her struggles
Hmm.
about her weight
Yes.
35 years ago. And she talked about the food she was eating. And I
Hmm.
remembered at that time identifying how different we were eating fresh vegetables. She was eating, you know, they was a lot of that diet started out with, you know, sweet potatoes and things, but then the way it got cooked was
Hmm.
different. We eat greens, you know, like everything was escarole greens and things like that.
Yeah.
However, ours was in olive oil and garlic and minor changes to
Minor
accompany
changes.
these. So your father was remarkable.
He really was. And it's funny, you said something that's really key. And I always tell people that Weight Watchers has been around for forever.
That's
And the
right.
reason
I was on it forever. I don't
everyone
think
was on Weight Watchers, right? But the reason Weight Watchers has been so successful is because you can eat what you want. You can't eat as much as you want, right? But it's
right,
the same thing as what you said, which is minor changes. If you like greens or if you like sweet potatoes, you can have them, but you can't all of the additions. You might want to not cook them as long because you're cooking out the nutrients. You might
right,
want to add a little bit of sea salt as opposed to regular salt. These are the things that in my training, my coaching, what I teach people, that it's just minor changes
right,
that I utilize and I implement. I don't make it, no, very difficult. I make it very, very simple, making sure that you season your food intentionally.
right,
Things that are going to prevent disease as opposed to promote disease. It's
right.
very, very simple when you when you switch out minor things and make minor changes. I had a boss when I was working full time, and she was addicted to Pepsis. If she watches this, she's gonna know that I'm talking about her. And I told her, I said, well, Doc, how many Pepsis do you drink per week? And she said, maybe 10. Let's say it was 10. I don't quite remember the number. And I told her, well, next week, I want you to drink 9. And the week after that, 8. And then the week after that, 7.
Right.
Just making sure that she created good habits that didn't seem so outlandish, so far-fetched. Many people think that eating healthy. Now, don't get me wrong, there are some systemic issues like food
Correct.
habits, right? That
Mhm.
affect how we eat and our access to good, vegetables and produce, etc.
Correct.
But when you get those things, make minor adjustments and make them on a gradual basis, and I
Correct.
promise you, it'll have lasting effects as opposed to a quick fix.
You know, and I have to say very clearly, you know, because people will say, "Oh, well, that person juiced and they're still sick." yeah, but you feel better
Yeah.
before any illness. Like you get better quality
Mhm.
of life for the days that are good when you have a cleaner, unprocessed
Mhm.
diet in your life.
Yeah.
It does not, I'm not sure anything's going to stop any of us from dying and being sick. I mean, I would love for that to happen, but it's also about valuing the moment by moment experience. So I want to take that directly to this moment by moment. So here I am,
Yeah.
a pregnant person in an underserved community. Talk to me about the healthcare gaps in that community versus
Absolutely.
mine.
So it's funny because I worked for FQHC, which is a federally qualified health center.
Okay.
And what I saw working in that community is that you have a lot of women who are everything for everyone. Their priorities are different than, say, your priority, right?
Right.
And we say that the system is broken, but the system is not necessarily broken. It just was never created to target that particular type of patient, right? It
Right.
wasn't designed for marginalized women in mind. Black and brown women are more likely to be ignored, misdiagnosed, or treated with
Yep.
bias. So these are things like bias that they're being exposed to. Access, education,
Yep.
advocacy, right? These are things, and then also access to quality hospitals. I have a story about where I trained. Where I trained, it was at a very prominent hospital. And I remember that there were Black and brown women who came to this hospital to deliver because they knew that they would get better care. The issue is that in that moment was that their doctors weren't necessarily on staff at this particular hospital. So what happens is you go into the hospital just to deliver because I know I'm going to have improved outcomes. However, the doctor who's delivering me or the team who's delivering me, they know absolutely nothing about my pregnancy history, about my
Right.
medical history, right? So here, and then you, when you lack health literacy, I don't necessarily know how to communicate to this doctor that doesn't know me because I'm what we call a poor historian, because I don't really know the
Right.
translation of the words, right? I don't know how to communicate to this doctor who's never seen me, even though I know that I'm going to get good care at this particular institution. I don't know, they don't know my history, and I don't know how to translate that information because I don't really know anything about healthcare, right? So then you talk about in the postpartum period where a lot of these women have Medicaid, and it was a fight for us to get Medicaid covered up until a year postpartum. So you have gaps in coverage, disrupted prenatal visits, lower access to specialists, and then not to mention things that are in their environment like chronic stress and racism. Constant exposure to racism, constant exposure to just stress is going to increase your risk of health care or hypertension, preterm birth, complications, right? And so you take all of those things
Yep.
and then you get a bad outcome, right?
You know,
And can I
and
cancel my visit? Can
I
I,
will
you
I
know?
will tell you that that instance, our health history, no matter color or economic status, is
Mhm.
one of the areas I hope AI solves within the next 12 months because wherever I show up, my
Yep.
data shows up
Yes.
accurately from place to place to place.
Yep.
That
It's coming.
I know. I know, and that is, but having experience just recently, because my husband's in the medical system because he's 91 years old. It doesn't mean you have to, but he does have a chronic condition that requires specialized care.
Mhm.
However, this chronic condition is not caused by diabetes because he doesn't have diabetes, but it
Mhm.
looks like diabetes.
Sure.
The chronic condition he has appears to be diabetes. For
Mhm.
11 years, no, 2011 was the first time I put him in this one hospital. So 14 years, every time this man goes to the hospital, which in the last 5 years has been every year,
Wow.
the first doctor that walks in will say, I see you have this, you have diabetes. And they actually put it on the board.
Uh-huh.
I've been fighting to get that out of his record.
Mm-hmm.
This time I decided to stop the fight. I stood there and I said, I let them put the word up there and I said, now let me explain something to you. You either prove to me that you get this erased from your entire system, or my attorney will be writing you that letter because you're going to kill him doing something wrong because he doesn't have diabetes and you're not
Sure.
working on what he does. And that's when the system
Mm-hmm.
overall, like we all start out with a system and then you have the issues you talk about that people just don't appreciate. I want to support your experience 10,000%
Mm-hmm.
because I had the privilege of interviewing a world-renowned heart transplant by the name of Dr. Hannah Valentine out of Stanford. She was born in Africa, educated in London, then ended up at Stanford. She was doing heart transplants at the highest level globally.
Mm-hmm.
And she noticed not her white counterparts, who are all of the same intellectual level, that black and brown people were rejecting at a higher level. And she pulled people together and did a study and observed that. She has now had patented proof of why that occurs at the genetic level, that the drugs being designed needed to be designed differently
Mm-hmm.
in order. And these are things that, in the haste of a medical system that already is trying to serve a lot of people,
Mm-hmm.
those observations can only come from first person experiences.
Mm-hmm. Mm-hmm. Absolutely. And and what happens is, and keep in mind, as we talked before you started recording, is that I take care of a sick dad, right? And
Mhm.
I watched it firsthand, people label in the chart, but also not take the time to listen when we say that this is not working because they're so used to operating on algorithms as opposed to integrating human interaction and human feedback because we want people to be a part of the team, an important part of the team. However, when they speak up, then it's ignored. So it's important for other doctors to do their studies and to listen when we
Right,
say this isn't working or this particular medication that should work in this particular population does not work, right? As opposed to continuing to throw this medication at someone because of an algorithm, because of what you were taught in medical school or what you were taught in residency. We're not taking the time to think. And I'll tell you an example of when I did this for my patients. So many of my patients who were overweight in this underserved community, they were coming in with postpartum bleeding, or they were coming in general with bleeding that we had not diagnosed. And so
hmm.
at the time, the American College of OBGYNs was recommending that we biopsy women over a certain age. Well, these women who were coming to me, they had what we call unopposed estrogen because they were overweight for a very long time because of, just access to food, et cetera, et cetera. And they didn't know what they didn't know. I took it upon myself to biopsy these women before that particular age because I knew that they had been overweight for a very long time and they had unopposed estrogen stimulation, and that increases their risk of uterine cancer. I
Right.
biopsied these women and found uterine cancer in young women who had been overweight for a very long time. And that, had I just gone with the recommendations and used the algorithm of how to biopsy these women, they would have stage 4 cancer to this day, or no one would have diagnosed them. And so I said, okay, if uterine and ovarian cancer are the cancers that we can't screen for, we can screen for cervical cancer through the pap smear, but we can't screen for ovarian or uterine because there's no screening tool or, there's no guide
Hmm.
on that. Let me help to prevent it. Let me teach you
Right.
how to eat right. Let me show you, choose this over this. And I would give them Dr. EJ's 5 rules for weight loss. And I would tell them increase water, increase green vegetables, fresh, preferably,
Yep.
or frozen if they don't have access. Decrease sugars, decrease the sauces that they're dipping their foods in. And then I would say increase the number of times you eat per day. Those are my simple rules that I'm going to give you. Implement those things,
Fabulous.
and you're going to decrease your weight. And then you're going to decrease your risk of uterine ovarian cancer or obesity related cancers. When they
Right.
did this, things drastically changed. And really, that's what the whole Dr. EJ came from. People start calling me Dr. EJ because I was everywhere and I was giving them tangible tools that they could utilize in order to prevent disease.
That, I love it because what you are talking about, nutrition
Mhm.
and the relation in females to hormones and estrogen and things that happen because of the foods we're eating is the exact science that's coming out of the 30, 40, 50 year olds when it comes to perimenopause, menopause,
Yep,
that
absolutely.
you can impact your hormonal profile and
Mhm.
thereby the diseases that may be caused by them being off balance
Yeah,
by just, I mean, and it's no easy thing to just do your food. Those
sure.
5 steps, give us the 5 steps again.
Increase the number of times you eat per day, increase water, increase green vegetables, fresh or frozen, preferably fresh, decrease sugars, and you get them from a lot of hidden sources, not just juices. These are from the dipping sauces. These are
Mhm.
from when we talk about eating clean, we need to be able to see it, not a lot of juices and gravies and things of that nature. And then you also want to, what was the last thing that I said? Increase the number of times you eat per day.
Well, you had said the sauces, stop,
And okay.
cut back on the
Okay,
sauces
the sauce.
was the fifth one originally.
Yeah.
Yeah. Yeah, those are the things. And, what I appreciate is we're talking about the medical system, we're talking about the disparity within the system, and then we're talking about the things people can control 100%.
Yes.
So that
Yes.
maybe you never have to get in that system unless, of course, you want to have a baby.
Right.
So that brings me to collaborations.
Hmm.
Um, I happen to know about midwives and doulas because my daughter did have a birth doula,
Hmm.
and she was at Mount Sinai Hospital. Unfortunately, it was the height of the pandemic, and the doula was zoomed in, and no one else was allowed, to come. But a renowned hospital such as Mount Sinai in LA, it was perfectly normal if a patient had something like a doula. But explain to everyone those types of support systems that communities can call in.
Yeah. So some people don't know what a doula is,
Yeah.
and I think that they need to be universal. But doulas provide emotional, physical support, and many times mental support as well, as opposed to, let's say, a midwife, which is more personalized care as it pertains to a pregnancy, right? An OBGYN brings more surgical, medical expertise, but together, when we talk about
Mhm.
collaboration, together, we just give women a safer, more empowered birthing experience, right? Doctors, midwives, and doulas aren't competitors. We are the village. This is the village that
Correct.
they need to create. And so it's so important for all three to work together. It's a team sport, right? And I'm truly, truly, truly pushing that because many people think that we should operate in silos, that it's a us versus them. No, when we all work together, outcomes improves, birth becomes respected and not feared.
Right. And one of the things that I want to address, so everything costs money. So
Mhm.
if you're adding the doula into the mix,
Yes.
talk to me about solutions. How does that get covered in communities?
Let's talk about that. So many times, not all, but there are certain times where health insurance plans will cover doulas, right? The issue is that it's not universally covered. The other issue is
Oh,
they're not reimbursed the way that they should. In some places, doulas are reimbursed $1,500, and that's nothing when you're thinking about even the full pregnancy and the postpartum period. So
Right.
so we need it universally covered. And we also need the reimbursement to be higher for doulas as well, because they play a very important part of the team. And I've said this on interviews before that I've done, is that I had a doula speak up during a delivery or prior to a delivery when a woman was getting ready to get an epidural. And the doula remembered an important part of the patient's history that she had forgotten, or, she just didn't.
Yeah.
It's a lot going on. You got preparation, you probably got kids at home. It's just a lot, right?
Hmm.
And so she spoke up, and when we were asking about her history, she spoke up and said a key piece of information that really helped this patient, and it helped
Wow.
save her from potentially being paralyzed. And so it's so important that we think about these things. And if we know that there's a shortage, for example, in the state of Nevada,
Hmm.
shortage of
Of
doctors,
everything when it comes to
shortage of
medical,
everything, right?
everything.
A shortage of everything. But in a lot of places where there's a shortage of doctors, or let's say as an OBGYN, let's break this down. I may be the delivering doctor, but I may have other patients that are on the labor floor. I may have patients in the ER, because when you're on call doctor, you also take care of women who come through the ER that need, whether it's gynecological surgery or some type of intervention. So I may be even setting this patient up for surgery. I also do C-sections. And then let's say there's another patient who's in the hospital who's admitted to another type of doctor, right? Let's say she's admitted to an internal medicine doctor, but she has some type of gynecological complaint. Well, I'm also responsible for her as well. So
Wow.
whereas now you have the midwife who exclusively focuses in on labor. Then you have the doula, who's a support person who can, be the translator to some degree of translation of information. And when you do that, we all work together. The midwife can tell me key information that, while I'm in the ER or on another floor. So all of those things, I don't think that many people, the lay person doesn't necessarily know what all we do. So that's very important to note, that we may be on labor and delivery, but we also may be responsible for the ER. We also may be responsible for taking someone to surgery. We also may be responsible for many other patients in the hospital that have some type of gynecological complaint.
Wow.
So when you talk about an us versus them, I hear this all the time. No, we need to cut the ego side of things out. I need you, you need me. They're not many midwives who do surgery. And now I have in
Right.
different parts. Remember, I'm licensed in 16 states. So in New York, I scrub C-sections with midwives, but I may go to another state and the midwives don't do any C-sections, or they don't do them, but they just assist. Okay.
Right.
You have some who are not comfortable, other ones who are comfortable, some who see patients in the community, and some who don't see patients in the community. So it's important to know how we all work together, you as a patient, women as patients, to significant others, support persons. It's important to know how things work together so that we can give each other grace, right? And we can have
Yes.
a better working relationship.
Yeah. Great. And I have to say, that's where the complexity
Mhm.
of good care, it's so much easier never to get in the system and stay healthy on the front end
Yeah,
so
it's
that
so
that
important.
part of it goes more smoothly. I know that that's a lot of that you really do focus a lot on products and solutions
Mhm.
in order to make the system work the best it can possibly work.
Yes.
Tell me some of that aspect of your work.
Sure. So just a little bit of history, and I kind of touched on this earlier, is that I created products in response to my patients because I saw that they lacked health literacy. And I saw that there were a lot of things that could be prevented. And I also didn't want them to be overwhelmed with misinformation, low quality products, false promises. And I wanted to make sure that they had safe, science-backed solutions for many things, right? First, the first of all products really was education. And so my book is one of those educational tools. I have downloads that are some of those tools. I develop a text weight loss coaching program. And so that I can remind my patients, eat this, not this. This is a good time to eat, because many times women, we're so busy that we forget to eat, but not eating is worse than overeating. And that's what I would tell my patients all the time, because what happens is you start those cravings late at night, and then you start carb loading. So whether it's sugars,
Yeah.
things like that, I have a lot of women who say, oh, I crave sugar at night. Well, it's because you have not put the right sugars in your body throughout the day. So at the end of the night, you're crashing, you want sugar. And then what happens is your body holds on to that, and it holds on to it in the midsection. So I developed a text weight loss coaching program. I developed a coaching program where people can actually, book me, do consultations with me to get coaching for just wellness in general. And many times they need help balancing. They need help prioritizing their wellness. And so I have coaching programs to support that. I have some other products coming. I have an app that's being developed that will be coming as well. And I also have a few other wellness products that are coming. So stay tuned for that. And I have a documentary that we start filming in a few weeks.
Oh, so tell us about the well, first I want to mention about the sugar. So
Yeah.
sugar has always been my drug of choice. When I said before that, I was in Weight Watchers since I was 8, it was because although my mother and father, my father was a butcher, so the meat came straight from his own store. The My mother went to literally the vegetable stores every single day, but carbohydrates, pasta and bread were a main
Yeah.
source, but sugar was my friend.
Yeah. Yeah.
I had been sexually abused as a young child, and I found out at a very young age I felt better when I had sugar.
Mm.
So it was an unfortunate set of ways that I got to who I was around my food. I will
Mhm.
tell you that having done all this research for this presentation on perimenopause and menopause,
Mhm.
the fact that I now eat protein
Mhm.
and larger amounts of protein
Yes.
ever consumed before.
Yes.
Now that means for me fish and chicken.
Mhm.
I do a lot of vegetables. I always have,
Mhm.
but I find that when I've had really protein at breakfast, protein at lunch, protein mid-afternoon,
Mhm.
those sugar cravings don't
They
exist.
go away.
It's like
Yeah.
I
It's a
remember
numbers game.
saying
Yeah.
to my trainer, like, part of me doesn't want to give it up, but I don't crave it the
Yeah.
way I did. And I love not being a victim of my cravings.
Yeah. I feel like maybe that was the fifth tip was increased protein. If
Oh,
I missed that one, it was increased protein. So chicken,
okay.
fish, not fried. That's what I would say. So I
Right.
did that one. But protein, 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 ladies, I promise you.
Yes.
So I used to draw pictures for my patients, and they would say, can I take that? And I'm like, yeah, I got it up here. I want you to take this home. So I would draw a simple circle as to represent a plate. And then I would draw a line down the middle to split it in half. And one half, I just wanted green vegetables. And then the other half, I'd take it and I would make it three-fourths. And I tell them the three-fourths should be protein. And then the fourth should be your carbohydrate, clean carbs,
Right.
right? Things like a sweet potato.
Mhm.
I even let them have a red potato, basmati rice, or
Right.
you can get them in additional vegetables as well. But protein, 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 ladies, and that's what I teach in my courses. That's what I teach in my coaching is how to eat, but also when you're a busy woman, how to do it on the go, right? I take it, I can tell you I'm in the hotel room now if you haven't been able to tell. I have my jump rope and my resistance bands,
There
right?
you go.
Take them, I travel. I tell people that my jump rope and my resistance bands have more sky miles than most people.
I love it.
I travel with them. I buy gallons of water. I make sure that if someone is booking me to speak or whatever, and I'm going to be gone a while, I make sure that they book me with the kitchenette so that I can cook, so that I can meal prep. Um,
Right.
and I'm very intentional about that. And I was so crazy at one point that when I was studying for my oral boards, I was taking a review course. And I made them, I called and told them, put me on the floor with the gym. And can you put a microwave in my room?
Right.
Because I meal prep prior to coming. I'm
Yep.
just so insane with it. But I'm still those habits I take with me everywhere. And, people.
And I will tell you, so I resemble what you're saying,
Mhm.
and the benefit of that level of crazy is I can say for myself, I am as healthy as a 70-year-old should be. I mean,
Mhm.
there is a correlation. Yet I am not obsessive, but I
Yeah.
carry food with me.
Yeah.
And it's food that doesn't have sugar in it. It's bars that don't that are done with date sugar. You do research. I
Mhm.
have proteins powders that I use. I have worked at it, and it is part of how I live my daily life. And I will also say, am I crazy if I'm going away for 2 days and I can enjoy a meal as much as anyone anywhere.
Mhm.
But I really use that 80-20 rule. If you're really
Yes.
diligent about these things and you have it's not you shouldn't be doing the I want everything I want 80% of the time. That doesn't make sense.
That's Weight Watchers. It's the philosophy behind Weight Watchers. You can go out and have a good time if you're going to brunch or hanging out with your
Yeah.
girlfriends, a happy hour. But
Yeah.
don't carry this brunch and this happy hour into your home.
Not all
So,
week.
you shouldn't be doing it every day, all day,
Correct.
and also you have to change your relationship, your mindset surrounding food. As you stated, unfortunately, you did it as a coping mechanism,
Right.
because of a traumatic experience.
Right.
And so we have to change our relationship and our mindset around food and not necessarily use it to cope, but use it to heal. And I
Correct.
think that that's important. And even this foundation in the pre-pregnancy part, I use a large portion of my book and my courses to educate pregnant women or women wanting to achieve pregnancy on eating and nutrition and making sure that you stay active. And when you get to the labor room, it's labor. So let's make sure that you have the right pelvic floor exercises to help prevent injury and also, to be able to push effectively.
Yes.
All of these things are so important. And it's small changes and changing your mindset around being well is where you
Yeah.
should start.
Yeah. You know, we've touched on a lot of the various areas that I wanted to make sure. Is there any area that you want to make that we haven't touched on that you want to make sure we get in on our conversation?
Women pre-pregnancy, and even in the postpartum period, or, if you're thinking about having more children, start planning your postpartum. We plan
Hmm.
baby showers, we plan weddings, but we don't plan the postpartum period. It
Right.
is essential
Yep.
that you plan the postpartum period, and that's because a lot of complications happen during
Be
that.
specific. I know what it looked like for my daughter, but be specific. What does it mean to plan that?
So let's talk about it. I tell this story on all my interviews. My best friend just had a baby. We're celebrating 6 months today. Is it today? I think it's today. Oh no, 2 days ago. She
Okay.
hit 6 months. I didn't buy her anything for her baby shower at all. And this is my goddaughter.
Uh-huh.
What I did was I sent her meals every week. I sent her catering every week for her and her family for 6 weeks.
Correct.
If you're head of household, you're going to be the person that's cooking or the person that's grocery shopping. But you
Hmm.
got a new baby, and let's say you have other children, a significant other, you need your load lighting. Okay. Start planning who is going to start identifying who's going to keep your baby when you just need a break, when you need respite for yourself.
Right.
Plan that person. Your yoga instructor, start planning those, finding postnatal courses so that you can make sure that your mindset, when you get a journal, right? Because like I stated before, many times the postpartum depression or the postpartum blues, all of these things you don't necessarily know are going to happen to you. And so you want to start planning for those things, planning your wellness, plan a break, These are the things, and you need to start building your village up, building your team to say,
Yep.
okay, and the village needs to be prepared as well. The village needs
Correct.
to know how to also identify, not just from a wellness perspective, from a mindset standpoint, but what are the complications that we see in the postpartum period, like postpartum preeclampsia? What are some things that I should look for in my significant other or my friend or family member that just had a baby? Is her face swollen? This could be a sign of preeclampsia.
Wow.
Having pain or blurry vision or pain on the right side. This could be a sign of preeclampsia. So make sure that your support system also is educated. And that's what I've really been targeting, is making sure, because the pregnant woman, she
Well, I would say they don't even necessarily have to be educated. The fact that they listen and don't assume, oh, well, you just had a baby. Oh, well, you just had a baby.
yeah,
Really listen to the person.
listen, but also you should also be educated.
Yes.
Let me tell you, we need help. We need help in identifying these postpartum complications. And it's very simple. Spots in their vision, call us.
Yeah, yeah.
Significant other. If their face is swollen out of proportion and it seems different, call us. Check their blood pressure, get them a blood pressure cuff, get educational tools for during the baby shower so that you can also be educated, and the pregnant woman can be educated as well. We need help, right? We need
Right.
extensions of us so that we can identify complications. So no, it's not just about listening. I'm not saying I need you to be a medical expert, but be my eyes and ears so that I can best treat your significant other or your loved one.
Yeah. Thank you. And I'm going to make a note of something in our conversation. I happen to love men, and I realize that we've had a very deep conversation without them in this conversation almost at all. And I think at some point in the future, we should have that conversation, because part of that community building and that support system is also that. And it's as specific as the things that you've been saying. I know that my daughter had food trains set up, and she now has a whole colony of people where, whether
Yes,
your kid is sick or
yes,
someone going to the hospital for a cancer treatment, they've got lists of people who just automatically take over the different days of who's going to bring food.
yes.
So there's different ways to do it, and I've just loved all of this, and
Yeah.
I
And
do
I
want to
have
ask.
downloads for dads specifically on
Cool.
the
So
website.
give us your website again. We got to have that.
It's drej.com, and that's doctor spelled out doctorej.com.
Perfect. Now, if you could give just one message to every woman and every mother listening, what would it be?
You know, mothers need to understand that you deserve joy, you deserve rest, you deserve to be heard. Your life has value. So asking for help is not weakness, it truly is wisdom.
Hmm. Yeah. And then just think how great you'll be training your own kids. If you ask for help, you'll train them to ask for help. It does work
Absolutely.
that way. Well, Dr. EJ, thank you so much. I am going to have all of your information in the description when this airs. So know that the information will be there. Thank you so much. I
Thank
look
you for having me.
forward to having you in Las Vegas and presenting to our community here at some time in the not too distant future. And I support you in continuing to still rise and do the fabulous work that you do.
Thank you. I appreciate that.
Thank you. I am Andrea Gigline. We all are still rising. Thank you.